Hello everyone, Sidra Kosar here. I'm a clinical researcher and physiotherapist at Cap Energy Barcelona. So today we are going to discuss clinical case with premenopause and abdominal fat. So let's start the presentation. So we have this clinical case with premenopause and female, 39 years old. Let's start. Obviously, we are going to discuss these topics today: introduction, anamnesis, exploration, in which we have done measurements and also measurements with in-body machine, complementary test, MRI and analytics, all of the laboratory tests, treatment goals, lipolysis based on scientific evidence, protocol, results, and conclusion. So let's start with the introduction. So as we all know that women in their whole life, throughout the life, they go through a lot of hormonal changes. So in premenopause, obviously there's a really disruption and imbalance of hormones. And because of imbalance of these hormones, there's a lot of a female, she goes through a lot of health issues. So as we know that main hormones are estrogen and progesterone. If there's a less production of estrogen and progesterone, obviously the main concern in female is gaining the body weight, and also it is directly related to the depression, anxiety, and stress. So obviously, so we are, as we can also, obviously estrogen is helps in metabolism of fatty acids, helps in obviously helps in the liver to degrade, and also increasing the metabolism of fatty acids by the help of the liver. So estrogen helps to metabolize the fat. In premenopause, estrogen levels obviously begins to decrease, so lipids, there's a lipid accumulation. There's a decrease in the production of progesterone, causing greater fluid retention, metabolism slows down, and the lack of estrogen causes, obviously there's changes in the physical, in the appearance of female, that is from gynecoid to android, that is pear-shaped to apple-shaped body. So anamnesis, she was 39 years old, she was a receptionist, and the health history that she was in depression, and obviously medication history was also she was taking antidepressants. So it means that if a female, she already had a medical history of depression, she's also taking antidepressant, it means if estrogen and progesterone level, these hormones are going to decrease, then there will be a more depression. And she was not doing any kind of physical activity, chronic medication, obviously antidepressants, and previous treatment she was taking, doing diets, but without any results. So next we see exploration. So we have done measurements before starting the treatment, and then we have done measurements after the treatment. So this is the left lateral view, this is the frontal, and this is the right lateral view of this female patient. So Z5 process, that is 93 centimeters, waist 99.5 centimeters, greater trochanter 125 centimeters, psychometer 40 meters, weight 90.7 kilograms, BMI 32.1. She falls under obese category, 168 centimeter height. Complementary test, we have done these MRI to measure the subcutaneous fat and visceral fat before the treatment, and we also have done these tests after the treatment. So subcutaneous fat, as you can see, 10,028 grams, and visceral fat is 3,377 grams. So complementary test also analyzes C-reactive protein 8.6 milligrams. So normally the maximum C-reactive protein that we have, it's usually falls 0.3 milligrams to 1 milligram. These are the normal ranges of C-reactive protein. But as you can see in this case, it is 8.6 milligrams, which means that there's a lot of inflammation and fluid accumulation in her body. Leptin 27.11 nanograms milliliters. Treatment objectives obviously reduce the waste. Waste reduction of subcutaneous and visceral fat, and achieve an improvement in general health as well. So lipolysis based on scientific evidence. So by using Dracarian, increase in the basic metabolism 139%. So all this achieved because the Dracarian technology is non-invasive, without having any pain, without using any anesthesia, without asking patients to apply for a leave from the work, and most importantly, without having any adverse or negative effects. So in this slide, as you guys can see, that Dracarian, how the mechanism of action took place. So fat cells, and then obviously the temperature, increase in temperature that led toward apoptosis of fat cells, and after the apoptosis of fat cells, triglycerides, they went into the bloodstream, and then from bloodstream to the liver, and obviously metabolism of fatty cells have been taken in the liver. So protocol, what was the protocol? So this is the Dracarian technology. You can see the machine, and in this treatment, what we have done, the patient, she was in a supine position and with a C belt and emitting electro-terminal over the abdomen and the receiving electro-terminal over the lower back. And it also have an intersection effect. So the target temperature was 51 Celsius. So the whole treatment time, it was 1 hour and 20 minutes. So 1 hour we have used this C belt, and 20 minutes we have done crossfires and drainage. So drainage, it was we are using also in drainage, we are using emitting electroterminals. We put these in feet, and we put the receiving electroterminal on the lower abdomen. So we are doing drainage to reduce the retention of the fluid in the body. So results, what we have gained results, this is the before and this is after. So all this we have achieved, you can see. This is a visible change you can see in this photo. These photos, like within 12 days, without even any exercise, just only with this machine, we have achieved this efficient result. So parameter Z5 process. In the next slide we are going to see, so parameter, we lost waist reduction, that is 8.5 centimeter. So measurements, Z5 process, waist, greater trochanter, picometer. Before and after, you can see that 93 we went to 90 centimeters, waist 99.5 to 91 centimeters, greater trochanter 125 centimeters to 122 centimeters, and picometer 40 millimeters to 25 millimeters. So weight, she lost 1 kilogram. Before she was 90.7 kilograms, and after 29.7 kilograms. So these are the photos that you can see. Left lateral photo before and after, frontal before and after, and a right lateral view before and after the treatment. So here we have mentioned that she lost 1 kilogram, and then parameter 8.5 centimeter, that is a waist reduction. So, okay, now we are going to see each value of like subcutaneous and visceral. As you can see, the subcutaneous fat, We lost, in this case, we lost 17% of subcutaneous fat just only within 12 days. So at the end, we lost 1,683 grams. That is 1.68 kilograms. In the graph, you can also see, and the visceral fat 35%. We lost 35% of visceral fat only within 12 days. So as we all know that if a person he has enormous excess amount of visceral fat, this visceral fat puts a person in a very serious health risks, that is heart failure, stroke, thrombosis, and a lot of other conditions, also endocrine disorders. So as we can see, it means that if we are going to reduce visceral fat, we are also reducing these serious health risks. So this is MRI of visceral and subcutaneous. As you guys can see that 35% before. This is the image. So we lost 35% visceral fat, and subcutaneous 17%. MRI image, you can see before and after. Visceral fat that we have lost 1.17 kilograms and 1.57 kilograms subcutaneous. These are the results before and after. Okay, now all of the laboratory analysis. Leptin, we are going to see 23% reduction in leptin hormone. So lost 6.11 nanograms milliliters. C-reactive protein that we have seen, that I also mentioned before, that 0.3 to 1 nanograms is the normal range. So as you can see that we lost like double amount of C-reactive protein. That is, at the end, we lost 4.03 milliliters of C-reactive protein, 46% in total. And in the conclusion, this patient almost twice as much visceral fat, 35% than subcutaneous fat, despite only losing 1 kilogram of weight and loss of weight reduction, that 8.5 centimeter, and visceral fat reduction is highly effective and significant in this patient. So it also depends on the patient, like either the patient, he or she has more subcutaneous fat or more visceral fat. As I discussed and explained earlier, that excess amount of visceral fat puts a person more in serious health problems than subcutaneous fat. So either we, as you can see that in this case, we only lost 1 kilogram, but we lost 35% of visceral fat, which means that we have lessened all of the serious health problem and risk in this patient. So hopefully you guys have enjoyed this presentation, clinical case. So take care of yourself. If you guys have any questions, so you guys can send me email on Kine, KINE@capenergy.com. So if you guys have any doubts, any questions, you guys can ask. So take care of yourself. Have a great day. Bye bye.